Welcome, balance seekers. Lucky the special dog and Mr. Bones and myself, Christine Farfan, physical therapist and Chopra scholar, are here to tell you how to treat your neck with the Balance Ball Sak. I'm not kidding. Now, you can get a sock, put 2 tennis balls in it, tie the end, and just make sure that you can move them and have them be supported. So it's kind of handy. If you want one of these, you can get one, but you don't need it, okay? So what we're going to talk about is our cervical spine. When we have neck pain, it's hard to tell exactly what's going on in there. So we are going to look at Mr. Bones. We are going to see where his vertebrae are and how tiny they are. I'm not kidding. Check this out. Look how small. These little spaces. These yellow things represent spinal nerves. Look at these tiny little joints. Those are called facet joints, where these vertebrae sit on top of each other. Yeah, not kidding. This is our first rib. Yeah, and that's when all is well and we're not overusing our neck muscles, and it still sits kind of above our shoulder blade. And then over here, this one, the paintings depict where muscles attach, has been getting pulled up and impedes in blocks, interferes with all of the nerves and arteries that go to the whole upper 1/4 of our body in the thoracic outlet through this triangle. Zoop, trap, clavicle, SCM. No joke. Thoracic outlet, so much tight stuff. So the deal is we have to open up your chest, open up your thoracic spine so your ribs can open up, and so that your spine can sit nicely stacked atop a very stable plumb line, ear, shoulder, hip, knee situation. Okay, that's what we're going for. So now what we're going to do is feel